My name's Alexandria Bryant. I live in Wood County, Parkersburg. Well, I'm a recovering addict, and I've had really bad depression, anxiety, and suicidal thoughts. And I really needed medication to help me with urges or sweats, like the Vivitrol shot, and just having my medication in general that's helped me stay sober was a big deal to me. The beginning part of my experience was very stressful because I didn't think I was going to make it. Um, with depression, anxiety, and suicidal thoughts, you don't want to do anything with your life. Um, you want to die. After I was able to get my medication, it made a big difference in my life. I mean, it it helped me focus on other things. The anxiety, medication, helped calm me down. Being able to get counseling and talking to somebody and finding out that I'm not alone, and then it's okay not to be okay, and then it's okay to take a pill to be okay. And I have been successful with life. I haven't needed street drugs. I am able to attend college full time as well as working a part-time job and just being a productive citizen of society. Throughout the years, depending on which insurance I have, or if I was underneath, my mom's insurance or something like that, she either made too much for me to get the full coverage I needed, or I don't know, just some of the insurance didn't cover the stuff that I took. So I constantly had to switch between different ones or get one of them little RX cards. And there's been times that I've had to ration out my medication to make sure I had more for the next day, pick which ones that were more important that I needed. It just depended, and also going through the trouble of having to sometimes go to different doctors to see if they would do a more of a generic brand of what I was taking so I could afford it. It made it very difficult, really. It was almost easier just to go back to using the street drugs than to wait to get into a doctor. It was hard to get the medication. It was hard to get a spot at the CSU or a spot in the hospital so you can get attention. Sometimes you would have to say you were suicidal when you were just depressed or just very anxious. There's been, if I don't have my medication, I'm more than likely to relapse because they go hand in hand, and I've got mental issues. So having RX cards and doctors that actually understand that helps us makes a big difference. Again, with the CSU, if you don't put yourself in CSU, you can't even see a doctor for about a month. They've actually even made more programs now, as in groups that are extra therapy groups. It's an hour long, and it's things that they're creating because there's such a long waiting list. There's one class that I started taking, which is recovery tune-up. It's just an hour class for the people who are on a waiting list to get in to see some kind of counseling because they're trying to figure something out. But yeah, I really feel like they should make it more accessible for people, no matter what part of the chart they're on, poor, middle, high class. I feel like there's just some medications that are meant to be free. We're trying to live. I don't know. If I was talking to a politician, if he was a diabetic, doesn't he need his insulin? I don't know, because with my mental illness, I need my depression meds and my anxiety meds. So I guess I'm saying is I want to live. That's all.